How to recognize fever in babies, and what to do and not do to lower it. When babies have a fever, it can be a stressful and concerning experience for parents. Recognizing a fever early and knowing how to respond appropriately can help you manage the situation and ensure your baby's well-being. Here's a comprehensive guide to help you understand how to recognize a fever in babies, what steps to take to lower it, and what to avoid doing. How to recognize fever in babies. Fever is commonly defined as a body temperature above 100, 4 degrees Fahrenheit, 38 degrees Celsius. However, babies are more vulnerable to temperature changes, so even a slight increase in temperature could be cause for concern. Here are a few ways to recognize when your baby may have a fever. 1. Temperature readings. The most accurate way to check for fever is by measuring your baby's body temperature using a thermometer. There are several types of thermometers available: digital thermometers, oral, rectal, or underarm, infrared ear thermometers, or forehead thermometers, although these can sometimes be less accurate in babies, mercury thermometers, generally not recommended due to safety concerns. Rectal measurements are considered the most accurate for babies under 3 months old. 2. Signs of fever without a thermometer. If you don't have a thermometer available, you can still notice signs of fever. Warm or hot skin. Feel your baby's forehead, back, or neck. If the skin feels unusually warm or hot, they might have a fever. Flushed face. A baby with a fever may have a noticeably flushed face. Shivering or sweating. As the body tries to regulate its temperature, your baby may shiver or sweat. Irritability or fussiness. Babies often become more irritable, fussy, or difficult to soothe when they have a fever. Reduced appetite. A fever can reduce your baby's appetite, leading them to drink less milk or eat less food than usual. Lethargy. Babies may seem more sleepy or lethargic when they have a fever. 3. Age-related considerations. For babies younger than 3 months, even a slight fever, above 100, 4 degrees 30 degrees Celsius, should be taken seriously, and you should contact your pediatrician immediately. For babies older than 3 months, a fever below 102 degrees Fahrenheit, 39 Celsius, is usually not a major concern, but you should still monitor it closely. What to do to lower baby's fever. Once you've determined that your baby has a fever, it's important to know the proper steps to take to help lower their temperature and make them feel more comfortable. Below are some safe methods. 1. Give plenty of fluids. Keeping your baby hydrated is one of the most important steps in managing fever. Fever can cause dehydration, so ensure your baby continues to drink fluids. If your baby is breastfeeding, continue offering breast milk frequently. If your baby is bottle feeding, continue offering formula or expressed breast milk. For babies over 6 months old, you can offer small amounts of water. Hydration helps the body regulate temperature and prevents dehydration, which can worsen symptoms. 2. Dress your baby lightly. It may be tempting to bundle your baby up in layers to keep them warm, but dressing them too warmly can cause their temperature to rise even further. Keep your baby in light, breathable clothing to help regulate their body temperature. 3. Use a lukewarm bath. A lukewarm bath can help lower your baby's temperature. Ensure that the water is not too cold, as this could cause shivering, which may actually raise their body temperature. Avoid using ice or cold water, as this can be harmful. 4. Cool compress. You can place a cool, damp washcloth on your baby's forehead, neck, or underarms to help bring their temperature down. Be sure not to make the cloth too cold, as it can cause discomfort. 5. Use fever-reducing medications when appropriate. If your baby is older than 3 months and the fever is causing discomfort, you may want to give them fever-reducing medication like acetaminophen, Tylenol, or ibuprofen, Advil. However, it's essential to use the correct dosage for your baby's age and weight. Always check with your pediatrician before administering any medication. Important note: never give aspirin to children, as it can cause Reye's syndrome, a rare but serious condition. 6. Monitor the fever. Keep a close eye on your baby's temperature. If their fever continues to rise despite your efforts to reduce it, or if it lasts for more than 24 hours, consult your pediatrician. 7. Provide comfort and rest. Rest is essential for your baby's recovery. Make sure they have a comfortable and quiet place to sleep. Comfort them as needed, either by rocking or soothing them with your voice to help them feel secure. What not to do when your baby has a fever. While it's essential to know what to do, it's also critical to avoid certain actions that can make things worse. Here are a few things you should not do. 1. Do not overdress your baby. Dressing your baby too warmly can raise their body temperature further. Stick to light, breathable clothing. 2. Avoid using cold baths or ice. Do not use ice or very cold water to lower a fever. Sudden temperature changes can be uncomfortable for babies and may cause their body to heat up again. Stick to lukewarm water only. 3. Do not administer aspirin. Aspirin should never be given to children or babies due to the risk of Reye's syndrome, a potentially fatal condition that affects the liver and brain. 4. Don't ignore high fever. If your baby is under 3 months and has a fever of 148 degrees Celsius or higher, don't wait for it to pass. Contact your pediatrician immediately, as this could be a sign of a serious infection. 5. Don't force food or drink. If your baby doesn't want to eat, don't force it. However, it's crucial to keep offering fluids to prevent dehydration. 6. Avoid giving unapproved over-the-counter medications. Some over-the-counter cold or flu medications may not be safe for babies. Always consult your doctor before giving any medication to your baby. When to call the doctor. It's important to contact your pediatrician if your baby is younger than 3 months and has a fever. The fever is over 102 degrees Fahrenheit, 38.9 degrees Celsius for more than a few hours. Your baby is having trouble breathing, is extremely drowsy, or is not responding normally. There are additional symptoms like a rash, vomiting, diarrhea, or signs of dehydration, e.g., fewer wet diapers. You're concerned or unsure about how to treat your baby's fever. Conclusion: fever in babies can be concerning, but by recognizing the signs, taking appropriate steps to lower the temperature, and knowing what to avoid, you can ensure your baby feels more comfortable and receives the care they need. Always consult your pediatrician for guidance, especially if you're unsure or if the fever persists. If you're looking for expert advice, helpful tips, and everything you need to know about pregnancy, childbirth, and the postpartum journey, you've come to the right place. Whether you're a first-time parent or expanding your family, my channel provides a wealth of information to help guide you through every stage. From preparing for pregnancy, understanding symptoms, to navigating the challenges of labor and recovery after giving birth, we've got it all covered. Stay up to date with the latest insights on how to care for yourself and your baby, tips on breastfeeding, and emotional well-being throughout this transformative experience. By subscribing to my channel, you'll gain access to reliable, practical content that will support you and your growing family. You'll learn everything from how to create the perfect birth plan to managing post-birth recovery and everything in between. Don't miss out on valuable advice and comforting resources that can help make your pregnancy and postpartum experience as smooth and informed as possible. Click the subscribe button and join a community of parents just like you, ready to take on this incredible journey with confidence and support. Thank you for being part of this amazing experience, and I look forward to being with you every step of the way. This message is designed to encourage viewers to subscribe while giving them an overview of the useful content available on your channel. It's warm, welcoming, and highlights the channel's role in providing valuable support throughout the pregnancy and postpartum phases.